Welcome to The Explainer. Today, we're jumping into the incredible world of brain stimulation therapy. This is where medicine is literally learning to speak the brain's native language, electricity, to heal it from the inside out. So, let's start with a really powerful idea. What if we could go beyond just pills or talk therapy? What if we could communicate with the brain on its own terms? That's what we're exploring today, the idea of treating conditions right at the source, by fine-tuning the very circuits that manage our thoughts, our moods, and even how we move. Okay, so here's our game plan. We're going to start with the big picture, then get into the basic principle of how it all works. We'll take a tour of the technologies, see the huge impact they're having, and then we'll peek into the future. All right, let's dive right in. For the longest time, the idea of directly interfacing with the brain felt like something straight out of a sci-fi movie. But it's not science fiction anymore. It's happening right now, and it's becoming a major, transformative part of modern medicine. So, the big official term for this whole field is neuromodulation. And what that really means, as the International Neuromodulation Society puts it, is that it's all about precisely changing how our nerves talk to each other to help restore function and get rid of symptoms. It's incredibly targeted stuff. And wow, this slide just shows you how fast this field is blowing up. I mean, look at this data from PubMed. The number of research papers on brain stimulation has just gone through the roof. We're not talking about a small bump here. This is a massive explosion in scientific and clinical interest over the last few decades. But what does it actually mean to speak the brain's language? How does this all work, really? Let's break down the fundamental idea behind it. Okay, the key insight is actually pretty intuitive. Think of a brain disorder like a symphony orchestra, where, say, the violin section is playing way out of tune. Instead of giving everyone a drug that affects the whole orchestra, these therapies are like a conductor walking over to that one section and helping them get back on key. It's all about bringing the whole system back into harmony. So, what's actually in this incredible new toolkit? Let's take a look at the different ways clinicians can now talk directly to the brain. And believe me, the list of options has grown like crazy in just the last few years. You can basically sort these tools into two main buckets. On one side, you have non-invasive therapies. These work from outside the head, no surgery needed. And on the other, you have implanted devices, which are surgically placed inside the body for more continuous, targeted stimulation. Let's start with a real cornerstone of this field, electroconvulsive therapy, or ECT. It's one of the oldest and most studied forms of brain stimulation. And as research from places like Johns Hopkins has shown, it's still one of the most powerful treatments out there for severe depression, especially when nothing else has worked. Now, I know ECT has a pretty controversial history, right? But it's so important to understand that modern ECT is a completely different ballgame. It's a safe, highly controlled medical procedure done under full anesthesia. It basically acts like a reboot for the brain's circuits, and for many people, the relief is incredibly fast. Next up, we've got TMS, which is a huge leap forward in non-invasive tech. This is so cool. Instead of direct electricity, it uses these powerful, very focused magnetic fields. A coil is placed on the head and it creates these tiny, precise electrical currents in the brain, changing the activity in just the right spots. And the really amazing thing about TMS is the precision and just how easy it is on the patient. Some advanced systems can even use an MRI of your brain to make a perfect map so the magnetic pulses hit the exact spot they need to. It's an outpatient thing, pretty quick, and you don't get any of the systemic side effects you might get from medication. All right, now let's talk about an implanted device, deep brain stimulation, or DBS. The best way to think about this is like a pacemaker, but for your brain. A surgeon implants these incredibly thin wires, called electrodes, deep into specific parts of the brain. Then they're connected to a little battery pack that's placed just under the skin in the chest. For conditions like Parkinson's disease, DBS has been a total game changer. It can dramatically reduce tremors and help people get their movement back. And now, it's showing incredible promise for really tough-to-treat psychiatric disorders too, offering a whole new level of hope when that continuous, precise stimulation is what's needed. Okay, so we've seen the tools, but what does this all mean for people in the real world? We're not just talking about one or two niche conditions here. This toolkit is changing the game across both neurology and psychiatry. I mean, just take a second and look at this list. It really shows you the sheer breadth of this revolution. From mental health conditions like depression and OCD, to movement disorders like Parkinson's, and even brand new areas like helping people recover from strokes or fight addiction. This is giving new targeted hope for some of the toughest challenges people face. And, behind all this science, behind every clinical trial, there are real people whose lives are completely changing. This quote from a patient really captures it all, going from being literally paralyzed by anxiety to waking up excited and rediscovering a sense of optimism. That's what this is all about. And look, this field is not standing still for a second. It is moving at lightning speed. Things that were considered experimental just a handful of years ago are now becoming the standard of care. And that pace is only getting faster, with huge breakthroughs happening all the time. For instance, check this out. Just recently, the FDA gave the green light to a non-invasive magnetic therapy specifically for chronic pain. This is a huge deal. It gives millions of people a powerful, non-addictive option that targets the pain pathways directly in the brain. And then there's this, which is just wild. Scientists are now literally combining brain stimulation with brain-computer interfaces. In one study, they paired tech that can read brain signals with targeted stimulation to help rewire the brain and restore movement in stroke survivors. I mean, that is the definition of cutting-edge medicine. And the therapies themselves are just getting smarter. Think of it like a smart thermostat in your house, right? It doesn't just blast cold air constantly. It senses the room temperature and only kicks in when it's needed. That's exactly what's happening here. The RNS system for epilepsy is a perfect example. It actually monitors brain activity and delivers a pulse only when it detects a seizure is about to start. So what this all boils down to is a massive shift. We're moving away from a monologue, where we're just kind of talking at the brain with stimulation, and moving toward a true dialogue, where we can listen to the brain signals and respond intelligently in real time. And that leaves us with one final, really powerful question to think about. We are truly just at the beginning of this medical revolution. As we get better and better at having this conversation with the brain, the potential to heal, to repair, and maybe even to enhance its function, it's just limitless. The next chapter is being written as we speak.